Nursing case study, Chronic Obstructive Pulmonary Disease, COPD. Patient information. Name, Mr. John Smith, age 68 years, gender male. Diagnosis, Chronic Obstructive Pulmonary Disease, COPD. Medical history. Mr. Smith has a history of smoking for 40 years, with a 20-pack-year smoking history. He presents with chronic cough, dyspnea on exertion, wheezing, and frequent respiratory infections. Assessment findings. Respiratory rate, 24 breaths per minute. Labored breathing, oxygen saturation, 88% on room air. Lung sounds, diminished breath sounds with expiratory wheezes. Cough, persistent productive cough with yellowish sputum. Activity tolerance, limited mobility due to dyspnea. Medication, prescribed bronchodilators and corticosteroids. Nursing case study questions. Question 1. What are the key risk factors associated with COPD in Mr. Smith's case, and how do they contribute to the development and progression of the disease? Answer 1. In Mr. Smith's case, the primary risk factor contributing to COPD is his extensive history of smoking for 40 years, resulting in a 20-pack-year smoking history. Smoking is the leading cause of COPD, and prolonged exposure to tobacco smoke damages the airways and lung tissue, leading to chronic inflammation, airway obstruction, and respiratory symptoms such as cough, dyspnea, and wheezing. Other risk factors associated with COPD include environmental exposures. Occupational exposure to dust, chemicals, and pollutants can contribute to the development and exacerbation of COPD. Mr. Smith's occupation or environmental exposures should be assessed to identify potential respiratory hazards. Genetic factors. Alpha-1 antitrypsin deficiency, a genetic condition, predisposes individuals to early-onset COPD. Although less common, genetic factors may play a role in COPD development and severity. Age. COPD predominantly affects older adults, and advancing age is a risk factor for disease progression and exacerbations due to age-related changes in lung structure and function. Respiratory infections. Frequent respiratory infections, particularly viral infections like influenza and respiratory syncytial virus, RSV, can exacerbate COPD symptoms and accelerate disease progression. Air pollution. Exposure to indoor and outdoor air pollution, including biomass fuels, vehicular emissions, and industrial pollutants, contributes to respiratory inflammation and exacerbates COPD symptoms. Socioeconomic factors. Socioeconomic disparities, including low socioeconomic status, inadequate access to healthcare, and limited resources for disease management, may exacerbate COPD outcomes and increase the risk of exacerbations and hospitalizations. Understanding these risk factors is essential for assessing COPD risk, implementing preventive measures, and developing tailored interventions to mitigate risk factors and improve COPD management outcomes for patients like Mr. Smith. Question 2. What are the priority nursing interventions to address Mr. Smith's acute respiratory distress and oxygenation needs? Answer 2. The priority nursing interventions to address Mr. Smith's acute respiratory distress and oxygenation needs involve immediate assessment, intervention, and monitoring to optimize respiratory function and alleviate symptoms. Firstly, the nurse should assess Mr. Smith's respiratory status, including respiratory rate, oxygen saturation, lung sounds, and effort of breathing, to identify the severity of respiratory distress and hypoxemia. Immediate interventions may include administering supplemental oxygen therapy to improve oxygenation and alleviate hypoxemia, titrated to maintain oxygen saturation within target range, e.g. 80–92% for patients with COPD. Positioning Mr. Smith in a comfortable, upright position to optimize lung expansion and facilitate breathing. Assisting with bronchodilator therapy, such as short-acting beta-agonists, SABAs, or anticholinergics, to relieve bronchospasm and improve airway patency. Providing respiratory support, including nebulized medications, chest physiotherapy, and incentive spirometry to promote airway clearance and improve lung function. Monitoring Mr. Smith's respiratory status closely, including vital signs, oxygen saturation, and response to interventions, to detect changes and adjust the treatment plan accordingly. Additionally, the nurse should assess for signs of respiratory distress, such as increased work of breathing, accessory muscle use, and altered mental status, and intervene promptly to prevent respiratory compromise. Collaboration with the healthcare team, including respiratory therapists and physicians, is essential to ensure timely interventions and optimize respiratory outcomes for Mr. Smith.